Hey everybody, this is Dr. Casey Johnson. Thank you guys so much for taking time to listen to the Unlock Wellness podcast. I know you're going to love today's episode with Dr. Danielle Belardo. Dr. Danielle is doing some amazing work and is helping so many people, so I'm excited to have her on to share a story with you guys. If you've been loving the Unlock Wellness podcast, be sure to jump onto iTunes, subscribe, and write a review. It really helps me out a lot, and I really appreciate all of the feedback and support. Also, be sure to follow me on social media to keep up with the latest podcast episodes. The best way to connect with me is on Instagram and Facebook. My username across the board is at Dr. Casey Johnson. That's DrKaseyJohnson. You can also check out my website at drcaseyjohnson.com. It has all of the past podcast episodes and more information about each guest under the Listen tab. While you're on my site, be sure to check out the Shop tab, where you can check out my first book of my Healthy Children's Book series and learn more about the Unlock Wellness Project, which supplies a wellness bag to a child in need for each book purchased. Thank you again for listening. I hope this episode leaves you feeling inspired to start making positive changes to your health. Now it's time for today's episode. I hope you love my conversation with Dr. Danielle Belardo. Welcome to the Unlock Wellness Podcast. I'm Dr. Casey and excited for today's guest. I'm here with Dr. Danielle Belardo. And Dr. Danielle is an amazing cardiologist who is dedicated to transforming her patients' lives, not just masking symptoms. And she focuses on lifestyle modification and plant-based diet in order to prevent heart disease altogether. So I'm excited to have Dr. Danielle on to share her story and just to talk about the amazing work she's doing. So, Dr. Danielle, thank you so much for taking time to come on. I'm excited to have you.
Thanks for having me. I'm super excited.
Yeah, so let's just jump into it, just into your story, where you're from, and then what led you to want to become a medical doctor and how all of that has led to, where you are right now.
Sure. So I'm originally from New York, but after undergrad, I did all of my medical training in Philadelphia, Pennsylvania. I went to Drexel for medical school, and then I did my 3 years of internal medicine residency at Temple University Hospital. And then I'm now a cardiology fellow at Lincoln Medical Center on the main line. And I really decided I wanted to go into medicine probably my last year of college. And I haven't regretted it since. I've really loved going into medicine, and cardiology was the subspecialty of choice for me for sure. There's a lot of great, ways in cardiology in that we can be involved in preventative medicine. There's a lot of different imaging modalities and a lot of new advancing technology, and the heart is my favorite organ. So I'm pretty happy about my subspecialty choice.
Yeah, that's amazing. So Dr. Danielle, when you look back on as a kid, did you ever think that's the career path you wanted to go? Did you like to help people? When you think back now, does that all make sense? Or because you said you decided that in college. So how did that kind of play out for you? Or can you know what I mean? Do you see those personality traits when you look back?
I have no physicians in my family. I think when I was younger, I may have at one point thought I wanted to be a doctor, but then probably also thought I wanted to be a lawyer, and probably also thought I wanted to do other things. I definitely like helping people. I'm a people person. And I think, being as a physician, especially in a clinical field of medicine, you're interacting with people on a day-to-day basis, all day, every day. I do like science, and, I think that there's a lot of, exciting things in medicine. So I think that it was kind of a natural career choice for me. Definitely can't say that I, was born, raised, and, head to the direction of medicine, but it kind of just popped into my, thought process as I went throughout college and examined other career choices. I volunteered at a pediatric hospital and, just enjoyed medicine in general. And then I'm glad I did, because it's been a really exciting and fun career so far.
Yeah, no, I love that. And it's interesting too, because, you were saying that you kind of were jumping around with what you wanted to do, but, as a physician, you have to wear so many different hats because, you obviously, like you said, you're dealing with patients, and patients are real people with real issues and not just oh, I have the sniffles, like here's the, like they have emotion, there's emotional things going on, there's family things going on. Like you have to deal with all of that and know how to deal with so many different personality types. So it's really helpful that you did have that kind of mindset to where like you had different interests, because I mean, I think it only benefits how you can like relate and help your patients overall.
I definitely will say that if you ask anyone that knows me, anyone that's trained me, or anyone that works with me, I am not your typical physician for sure. I definitely have a lot of outside of the hospital interests. I think that that's a benefit as a physician. I think I'm very relatable to patients. As you know, I'm very interested in plant-based diet. I'm really passionate about exercise, and I'm really interested in preventive medicine. And, you know, I have a lot of empathy. I have a lot of sympathy, and I think I have a pretty great emotional intelligence. So I think I connect with patients on a level that, you know, I'm very pleased with. And I find that that makes me a little bit of a unique physician to work with. I definitely have a lot of dedication to patient care, and I value my relationships with my patients a lot. So I think that it's really important that you find something in a career that you like, because being a physician is not for everyone. And I think that, you know, some people that do go into medicine and maybe it wasn't the right career choice for them end up, you know, maybe not providing the best patient care for their patients. So I think I'm lucky that I found something I liked. And I think that I'm a little different in that I have some, you know, unique interests, but I think that it's worked out well for me and my patients. So
Yeah, no, for sure. And you mentioned the plant-based aspect of it. So do you kind of want to like just walk us through how that became an interest? Like did you grow up eating that way, or like kind of what was your own wellness journey like, and then how that's played out into how you treat your patients?
Sure. So I actually have never really loved animal products. I just, you know, growing up, you know, my family wasn't vegetarian. My whole family's vegan now, but they weren't growing up. And I just like never found myself loving meat, loving chicken, loving fish. I just never was very interested in it. And so when, you know, I was old enough, I, you know, graduated high school, and I just kind of gave up meat and all sort of animal products altogether. I didn't go fully vegan. I was vegetarian at first. And then when I went fully vegan was, interestingly enough, so I was in medical school, and I have a super healthy family with regards to, you know, my parents are really athletic. They're both runners. My dad's done like a ton of triathlons. My mom just ran a marathon. And so my family's always been really into fitness and health and wellness. And my third year of medical school, you know, both my parents have no, you know, past medical history of any medical conditions. And my third year of medical school, my dad was saying to me, you know, what's weird, you know, my 8th mile of running, I'm having this like chest tightness. I wonder if I'm developing asthma. And even though I was only like a third year medical student, I was like, absolutely not, Dad. There's no way you're just developing asthma now. So you need to go to your PCP and get an EKG. So my dad goes to his primary, and my dad is of normal weight. You know, he is like very thin guy, always super athletic, always ate healthy, never ate any garbage. He just was like a super healthy eater, but, you know, always eating meat and animal proteins, but with tons of veggies as well. I would say he was like a healthy carnivore. And so he's now like almost completely plant-based. But that being said, he goes to his primary and has an abnormal EKG. You know, I have him taken for a stress test. It's positive. We sent him for a cath, and he had a 96 or 98% lesion in his right coronary artery. So for your listeners that, you know, may not know coronary anatomy, so there's 3 main coronary arteries, and those supply the blood vessels in your heart. So when someone has what's called a heart attack, a traditional heart attack that we think of, which my dad didn't have an actual heart attack. He just had symptoms from this blockage. But when someone has a traditional heart attack, it's usually when there's a blockage of one of the 3 main coronary arteries. So he didn't have an actual heart attack, but had, you know, this very severe blockage in one of his coronary arteries. And so they had to put a stent in. And, you know, he is very lucky in the fact that his heart muscle, so his ejection fraction, was always preserved and completely normal. He went back to running right away. He's, you know, still now to this day runs 5-8 miles a day, and he's doing excellent. But it really, you know, showed me that there's a huge component. Yes, there's genetics, but there's a huge component that we can control outside of genetics to lower our risk factor. I mean, my dad has always been the picture of health to us. And I know for sure, there's issues in lipid metabolism and things that affect the way, we do process lipids and the way we metabolize them. And, there's different issues that people have with genetics that can affect that. But the truth is that everything we can do in our power to change that and to do the best we can to not add dietary cholesterol to the endogenous cholesterol we make, I think is, pretty life-changing. So my whole family is vegan and plant-based, and my parents are doing great, and my sisters and even my husband went vegan. So I think it's been a good change for all of us. But I think that sometimes, it takes seeing someone that you think super healthy, having a kind of issue like this to reevaluate and say, there must be something to this. And that's where my interest kind of started.
Yeah, no, that's amazing. And I love that you brought up that story with your dad, because most people, they only look at either outside appearance or how you feel. But obviously your dad felt great. He went for long runs all the time. He was eating, like you said, healthy carnivorous diet, so and you said he was thin. It's not how you feel or how you look, it's how your body's functioning and healing. And most of the time you're not going to realize that until something goes terribly wrong. So, I mean, yeah, your dad was incredibly lucky, because, I mean, if he wouldn't have got that, I mean, a heart attack more than likely would have happened with that much blockage. Yeah.
And what's interesting too is that I think that that's a huge misconception, is that people think, oh, well, I'm not a smoker and I eat lean meat and I eat a ton of vegetables. I mean, there's been no research to prove that everything in moderation is healthy for your heart by any means, meaning that we really do look at everything you're eating with added dietary cholesterol is not good for you. Not to say that, listen, everyone has an uncle or a grandma that crap their entire lives and lived to 104, and good for them. But the truth is that there's a big combination of genetics, but also environment that plays a role in what happens with arteriosclerosis and what happens with our coronary arteries. And the way I look at it and the way my family looks at it, we're all very much into health and wellness, and anything we can do to optimize and feel good, I think that that's what we focused on. And I think that people have this misconception that, the people that come in with a heart attack are smokers, diabetic, with hypertension.
Right.
I mean, my dad has none of those, he's never been a smoker. He is super healthy, and he still has, to this day, a stent in his RCA, which, I'm keeping him on Plavix and aspirin and a statin forever. So it's, it's one of those things that he is super healthy and, very lucky he cut out meat out of his diet. But I do think that it's interesting that had he been vegan when he was 25 likely probably wouldn't have happened.
Right. And, you brought up the example of that uncle that's 102 and won't die, but is, microwaving bacon every, but you have to think about what their history looked like the food that they had in their system growing up. It wasn't all of these processed goods. It didn't have all of the antibiotics, didn't have the pesticides in the soil as much. They at least had a stronger base at the beginning. And you got to think about all of those factors that in their time wasn't like it is now. It's so much worse now. And I think it's super important for you guys to realize that if you're listening, because you can't go by oh, well, we ate this for so-and-so years and we're okay. It's you have to understand it's straight chemicals now. And you have to realize the source and make those adjustments.
Absolutely. And, what's really, really interesting too is that, listen, there's so much we don't understand about genetics still. And, with patients who do have that family member that's lived forever eating just chicken skin and unhealthy, I mean, good for them, but that is not the majority. 1 in 3 people in the United States will die of heart disease. 1 in 3. Every 40 seconds in the US, someone's having a heart attack. So, that is a huge amount of people. There are more people that die of cardiovascular disease than all cancer and lung disease combined. So it is the number one killer in the United States and worldwide. And so I think that, some people like to rest their, conscience on the fact that, well, I have really good genetics, but the truth is that's not everything. And we don't really know, how much that plays into the part with regards to also having environment. And I will say that, being a physician, I sometimes think it's funny when I watch some of my cardiology colleagues eating a lot of meat. Do often, see, it wasn't until I became a cardiology fellow that I was really shocked by seeing people that on the outside I thought would be super healthy and have no issues be rushed into the cath lab with a STEMI, which is what stands for ST elevation MI, and people with 100% occlusion of a coronary artery, that can result in death if it's not fixed quickly enough. And there are people that I see that do not fit that typical, wow, that's a really unhealthy person. Mm-hmm. And it's because, there's so many components to what goes into the way our coronary arteries develop plaque, that of course a plant-based diet, is one factor of many. And I just think that in a world where there's a lot we cannot control, it's a nice thing to be able to control some things. And I like to give that power back to my patients.
Right. Yeah. No, I had Kathy Freston on the other day on the podcast, and her whole thing is just progress, not perfection, because it's really it's impossible to be perfect. But like you said, if you can control things, food is something that you can control, and you can at least make the best decision that you're able to based on your where you live or like what you're able to do financially. Like there's always a way, but you have that choice.
Well, I think that's actually a great point. So sometimes people think because I follow a complete plant-based diet that I think all my patients should. And that's actually not at all what I'm saying. Ideally we would all eat a whole food plant-based, no oil diet, because that would protect us all from cardiovascular disease. And it's been shown to reduce diabetes, cancer, et cetera. But that being said, any improvement in the spectrum is an improvement in your health. So I always say more veggies is better than less, and less meat is better than more. So, if you are just making small adjustments in your diet, like just small changes, there was just a great article in that I posted about recently in Circulation, just replacing, animal protein with plant protein just 1 or 2 times a day can make a significant change in your lipid profile. So it doesn't need to be all or nothing. I do think that, even just small changes can add up and make a big change in your health and wellness.
Right. Like a meatless Monday, or maybe you don't eat animal products until dinner, or just making those small steps and then realizing like, hey, I still feel pretty great. And actually I feel a lot better. And then you start gradually replacing those. But just like, I think if first a lot of people, if they say, okay, never again, that's it's more scary, and they don't want those restrictions. So like small steps, see how you do, see how your blood work is, see how your weight is, see how your overall health is. And then from there, just run with it. But no, I love that.
Yeah, absolutely.
Yeah. Yeah. And you were talking about, your colleagues, I've seen a lot of different stories, or like these, we follow a lot of probably the same like plant-based people on Instagram and Facebook, and like people would like share pictures from some of these like cardiology conferences and heart association. And like, the meals, it's like buffets, just straight fried. It's crazy actually. But I'm sure you've seen a lot of that. And then didn't like the head of like the American Heart Association, like have like a heart attack or a stroke, like on stage or something? Like it's something crazy, right?
I know. Yeah, it's unbelievable. So medicine in general, so the average U.S. medical student gets U.S. allopathic medical student. I went to an MD school in the United States. I cannot speak for osteopathic. I know they do a lot of different kinds of education, so they may get more nutrition education, but the average U.S. allopathic MD medical student gets 19 hours of nutrition education. They're all 4 years of medical school. So everything I learned about plant-based diet was 100% from researching on my own during medical school and my internal medicine residency, and now as a cardiology fellow. So in general, I will say that, medical training leads to a very unhealthy lifestyle for many people. People feel overworked, overstressed. They're, eating very unhealthy, and some people are smoking, and, it's really not as many doctors as you think practice what they preach. So I think that it's really interesting that when we do go to some conferences and things like that there's like a lot of unhealthy choices. I will say that where I'm training now as a cardiology fellow, Lankenau Mainline Health has a lot of wellness programs. We actually have a farm on our campus.
That's cool.
We have tons of things that come from our farm straight to our cafeteria. It's the first time I've ever worked in a hospital that has a bunch of vegan options. And so it's actually been well received. And although I am the only completely plant-based cardiologist in my fellowship and in my department, everyone, for our holiday party this year, I chose a completely plant-based caterer, and everyone in my department was completely supportive of it. And we had a vegan holiday party, and it was fantastic. So I think that there are some changes that are going to beginning to happen with our generation. And I think that even in my fellowship alone, I convinced 2 of my best friends to go vegan, my 3rd year residency. And now one is a rheumatology fellow, and she's looking at, inflammation and plant-based diet and rheumatological disease at the University of Pennsylvania. My other friend is an internist, and she's, getting certified in integrative medicine and wants to practice similarly. So I think that, our generation, a lot of people are putting more stock into lifestyle modification, even though we've known this is a huge factor all along. But I think that it's actually becoming more popular, and I think patients are really seeking it out. Patients, when you go to the doctor, for anyone that's not a physician out there, I just want to give you an example of how I totally understand how confusing it can be. I went to the dentist recently, and although we get like a month of dental education as a medical student, like many years ago, I don't know anything about dentistry. So when I went to the dentist, my dentist says to me, "Oh, I have to do a filling here and replace a crown here." And I was like, I forgot where, and I kind of forgot what was happening. When I came home and I spoke to my husband, I was like, "Oh, I have to get something done at the dentist." And I can't remember. He's like, "How do you not remember? You're a doctor." And I'm like, when someone's talking to you about something you don't know or really aren't familiar with, it's like another language. So we have patients come into our offices, they have a certain blood pressure level or cholesterol level, and it's easier for us as physicians to say, okay, we're going to just go up on your blood pressure medication. We're going to just go up on your Lipitor, and make these changes rather than banking on the fact that, okay, this patient's going to make a huge lifestyle change. Because guess what? Not all of our patients want to make massive lifestyle changes. But that being said, there are many that do. And I think that we owe it to patients to give them the chance to take their health and autonomy back. When they come to the doctor and we sit there and we are just spouting medications at them, I am very pro-medication. Okay. We have medications such as statins, aspirins, things that have been proven mortality benefit. I would never take away from those medications. But that being said, again, we have plenty of people that come back into the hospital with a repeat MI or an occluded graft from their bypass that are on maximum atorvastatin, maximum aspirin. So what we're doing as a nation isn't enough. And I think that's one of the reasons why I think that, giving patients back that power with lifestyle modification can make a big difference.
For sure. Yeah. I mean, it's just giving them the choice, because I think too many doctors will assume that they don't want that. They just want a pill. Like, they're not going to do it. But really, who is anybody to judge where somebody's at? You could be looking at a patient and assume, oh, they don't want to change. They look unhealthy. They're not making healthy actions, but you don't know it. They could have just decided that morning, I need to make a change. And you can be that person to give them hope. It's like, oh, this morning I was just thinking I need to do something. You're giving me the information I need. That's like a sign, you know what I mean? You just don't know where that person's at and how that can just really snowball into just a complete transformation. It's just like you were, just saying, just giving them that option and giving them that empowerment back.
Exactly, because, as a patient, I always advocate for patients to always get second opinions and always do all the research they want. There's all these memes and jokes out there that doctors make about WebMD. And, there's some element of, actuality to that, where my sister will, text me something ridiculous that she found online. But I will say that, I do think that it's amazing that patients take their health into their own hands and really embrace and take autonomy and responsibility and feel that they have some power. I don't think that, we're enabling our patients enough to make lifestyle changes and encourage them to treat their conditions with food as medicine. And I think that we don't give them enough credit. And I think that there's a lot of people out there that do want that power, but they don't know what to do with it. And because there's so little plant-based nutrition, zero plant-based nutrition when I was a medical student. And because it's so under taught that, a lot of physicians don't even know. I just had dinner with a bunch of my friends from my medicine residency that I graduated from last night. And some of us are vegan, some of us aren't. And when we talk about the research and data and literature out there, half of my friends don't even know. And we've been physicians, we're all board certified in internal medicine, and we're in subspecialty fellowships now. And they don't even know about all the data and the research and the literature that's come out about this, because you really have to, seek it out on your own. So people who are looking for a physician that's going to give them this opportunity, it can be a little hard, because not every doctor you talk to is going to give you this information.
No, absolutely. And like you'd mentioned earlier that, your colleagues have been, pretty receptive and like open-minded to listening to what you're researching and like what you're putting out there. Like, do you think, just because you're constantly in that medical bubble, like in that world, like, do you feel like it is switching to more of lifestyle, or do you think this generation is starting to be different in the sense that, like, I feel like older generation, they just kind of feel like trapped in that common model, like insurance companies are like they're feel like they're not going to get paid, or they're going to have malpractice if they, a malpractice case if they don't prescribe, and then they give like a lifestyle option. Like, do you feel like that's switching, or how are you noticing?
Well, with regards to malpractice, I will say, so I am very evidence-based, right? So we know that there's evidence, mortality benefit in certain conditions. We have certain risk factor scorings. Like, I will not prescribe someone a statin or prescribe someone aspirin if they need it. If I know there's going to be mortality benefit, I will. That doesn't mean, though, that one is without the other. I do think that, we know for a fact, like I was mentioning before, that we have plenty of people that come in on maximum medications that are still having heart attacks, right? So
right.
The truth is that we're not doing enough. So I don't think anyone's worried about, it's not, so I don't believe that it's one or the other, either medication or lifestyle modification. I think that we need both. Some people are able to go off of their medications because of their lifestyle modification. So if you have very serious hypertension, I'm not going to take you off of your medications if your blood pressure is not controlled, because I don't want you to have a stroke.
Right.
But when I have had patients that I've been able to take off, I've had to take them off their medications because they've lost so much weight on a whole food plant-based diet. They've stopped eating salt, and their blood pressures dropped so much lower that they have to be off their medications because they literally can't even tolerate blood pressure medications anymore. And that's my favorite thing to do. So, I think that I practice in a way that I believe I want what's best for my patients. I want what has the most evidence for it, the most mortality benefit. I also want people to live their best life. And I think that a huge factor of this that I discuss with patients is that, whole food plant-based diet isn't just, going to make you live longer and, improve the blockages in your coronary arteries. It's the fact that you actually on a day-to-day basis feel better. And I'm covering cardiovascular disease here, but, as there's tons of, research and data that shows it helps with, your GI system, your gut microbiome, and, all the different things with regards to oncology. And there's just so much behind it that I think that, the most important thing is how great people feel when they start eating a lot of whole foods and plants from the ground. And I think that doesn't get emphasized enough as well.
Yeah, for sure. And like you're saying, it's searching for the cause and not just like giving a medication. Like you said, like you don't want to take somebody off their medications and they have a stroke, but like, but if like, it's like, well, okay, Susie, why are you why is your blood pressure so high? Like, why are you having these risk factors? And then like, once she makes those changes and you really get down to the root cause of it, then, the medications become irrelevant. Yeah, no, I love it. And I think that's definitely the way the model should be switching to, which I feel like with influences, like yourself, I think it is going to get there slowly, but getting there.
Yeah. Like instead of plugging the leaks, they say, we're trying to find instead of just plugging the holes, we're trying to actually find where the leak's coming from. So I think that, the way reimbursement is in the model is very procedural based. So obviously there isn't a ton of reimbursement for counseling and for things like this. Right. So that's
you can't see as many people with, if you sit down with somebody for 30 minutes or however.
Exactly. So I think that the fact that this is becoming more common and that we have a lot of references and things we can refer our patients to, I can't sit there and take 3 hours to explain to a patient how to transition to a whole food plant-based diet, but I can refer them to a bunch of amazing, fantastic resources online, books, things they can read and help them to, start their journey. And like I mentioned before, I think it can be intimidating. I think that some patients feel like they think that they're just going to be on eating salads forever. And I think that is what I try to definitely speak to, is the fact that, little small changes and just eating less meat and more plants, that alone can help you feel better and help to change your life. So I think that it doesn't need to be an all or nothing. I think that the more plants you eat, the better. And, the less meat you're eating, the better. But in general, I think that if people are going to start slowly, take baby steps, I think that's great. Also, though, I have had some people go full cold turkey and they, go completely plant-based and they revolutionize their body, their life, their health, their wellness, how they feel very quickly. And I think that that's really motivating as well.
Yeah. I mean, I can't imagine all of the positive results that you've been able to see. And like, as far as your blood work and weight and like you were just saying, I mean, I'm sure it's amazing. And I love like how you were saying too a second ago, that your willingness to refer people to other resources to help them get on that track, because like, I honestly think that's, how the model, like, I think how you can really just transform the whole system is if you get more like-minded physicians and more of like a close-knit web, like if you have like wellness physicians working with the medical doctors and more with like, like cardiologists and things like that. Like, I think when you can start working closer knit like that, I think that's really how like that transformation's going to really happen.
I agree. I completely agree.
Yeah. And just for a second, you were talking like about some of these amazing results that you were seeing. Like, do you have any like cases that you want to share that just really, inspired you and like, just that you want to like just share with people?
Sure. So I've had patients that I, have been able to, have started a whole food plant-based diet and that have been able to come off of their antihypertensives, have been able to go off of their insulin. We've been able to lower their cholesterol medication and make huge advances. One big thing that I'm trying to do now is at Mainline Health, I'm hoping to start a pilot program that's going to be about a once monthly plant-based cardiovascular prevention clinic, where we're going to, start to collect some data for these patients and take a look and see how patients who go on a whole food plant-based diet, how it affects more than just their regular lipid profile, but some of the very specific lipid tests that we send, in addition to, all the cholesterol and the carbohydrate metabolism factors as well. I think that, I love research and the fact that it gives us something to measure and to aim for. And then I think that if we do a structured program, it would be the first one actually in Pennsylvania, the first whole food plant-based preventive cardiology clinic in Pennsylvania. And I think the goal would be, if we get this up and running, would be to have a nutrition education session and component with it as well. We're still working out the kinks and trying to figure out how to make this happen. But I will definitely keep you posted. But we're hoping to keep this, make this happen in a way that we'll be able to give patients nutrition education in a session, as well as, treat their underlying cardiovascular disease. So I think that in general, I think the big misconception from physicians is that people think, that a lot of the physicians that are interested in a whole food plant-based diet, may be against medications. And I don't think that has to be the case. I just think that we can all coexist. And I think that a lot of patients end up not needing as many medications once they do their lifestyle changes. So I think that that's something that I really want other physicians to understand, that it doesn't have to be one or the other, but I think that overall, the way we're functioning as a society now isn't working. So something has to give.
No, absolutely. Absolutely. Just finding a way to coexist and actually get down to the root of it. I mean, it all comes down to just trying to get the patient to, they're, a person, and you just want to help them reach their highest potential as a person, So, I think everybody wants that same end result. But yeah, like you were saying, it's just what we're doing now is not working. So just, I think going this route is really what it's going to take to get there.
And it's tough to be a patient in 2018. There's a lot of conflicting nutrition information out there.
Yeah. And, like you said, Dr. Google or WebMD or whatever you're looking at.
There's a ton of, I feel like patients are bombarded with gluten-free, dairy-free, paleo, there's so much out there. It's very confusing. And, I think that it's nice to see some of the big organizations like the endocrinology organizations, supporting a whole food plant-based diet and giving some guidelines and structure and criteria. I think that medicine's catching up with, what we've kind of known a bit along.
Right. No, I agree. And like you'd mentioned that the research project that you guys are working on there, which is amazing. Is there anything else that you're working on that you just want to share with people? That way they can be, checking it out, just anything at all, or just more content coming their way?
Yeah. So this clinic is what I'm trying to get rolling out, hopefully in the next couple months. We'll be taking patients. I'll definitely be posting information on Instagram if we are able to get our patients enrolled in our whole food plant-based cardiology prevention clinic. That's pretty much my main focus now, in addition to just cardiology fellowship training. So, I'm learning echo, I'm learning cath, stress, all that stuff. So, it's continued education, and I'm just continuing to kind of find my niche in cardiology. And I think preventative medicine is something I feel really strongly about.
No, that's awesome. And you mentioned your Instagram account. What are the best ways for people to follow you on social media?
Yeah, so I'm pretty active on Instagram. I'm at the Veggie MD. And I'm going to be doing February for Heart Month. I'm going to be going through a lot of information about prevention, diagnosis, and treatment of cardiovascular disease. I've gotten a lot of really amazing questions that I'm going to touch on. For example, how does heart disease present in a man versus a woman? How does a heart attack present in a man versus a woman? What are some things with cardiovascular disease in pregnant patients? Who should be getting a coronary artery calcium score? I get that question a lot. Is it worth it? Who should be on a statin? So I'm going to be covering a lot of these really common topics and questions we get in cardiology, as well as treatment. What is a stent? What is a cath? What are these kinds of procedures? What happens afterwards? How long do you have to be on blood thinners? I have a lot of people that follow me on Instagram that have had these cardiac procedures and that don't actually really understand what happened. And so, we're going to go through that. And as well, of course, it'll be a huge focus on prevention, diet, lifestyle, exercise, and all the things we know that can help us prevent and reverse heart disease.
Yeah. And if you're listening, definitely give her a follow on Instagram. I've been following you for a while, Dr. Danielle, and you do put out really awesome, interesting research. And I know on my end, I've really appreciated that, just keeping up with all of it. So definitely love what you're doing. Are you also on like Facebook or Twitter, or you just stay mainly in Instagram?
Instagram, I got to be honest, it's hard to to hit all the social media. So I've just focused.
just focused on Instagram?
Yep, that's it. But cool. I do have a website. I'm www.theveggiemd.com, and I post some extended versions of my posts on Instagram as well.
Perfect. And then Dr. Danielle, just closing question that I ask every guest, but if you just had one piece of advice for the audience, maybe it's been your biggest takeaway through your whole journey so far, but if you just had one piece of advice to give, what would it be?
It would be, don't be scared to make a change. So just because your mom, your grandma, your dad, your cousins have always eaten this way and always live this way, it doesn't mean you have to. And don't be scared to take the leap and make a jump and take your health under your own control. And don't be scared to ask your doctor a lot of questions and find a doctor that you're comfortable with that is invested in your health just as much as you are.
Love it. No, that's perfect, Dr. Danielle. And just thank you so much for taking time to come on. I'm just excited to see all of your work that's coming up.
Thanks a lot. Take care. Thanks for having me.
Thank you guys so much for listening to today's episode. I hope you loved my conversation with Dr. Danielle. She's doing such amazing work and is changing so many lives. Be sure to give Dr. Danielle a follow on social media to keep up with the amazing things that she's doing. You can find her social media links and website that we talked about in the episode in the show notes, but you can also find them on my website as well at drcaseyjohnson.com. That's drkaseyjohnson.com. Click on the Listen tab. Then from there, you'll be able to see all of the past guests that have come on the Unlock Wellness podcast, read a little bit about each guest, and be able to click on their social media links, websites, all of that. So all of Dr. Danielle's information can be found on my site as well. If you guys loved today's episode with Dr. Danielle, be sure to jump onto iTunes, subscribe, and write a review. It really helps me out a lot, and I really appreciate all of the feedback and support. Thank you guys so much again for tuning into today's episode. I hope you loved it. I hope it inspires you. And most importantly, I hope you take action.